Hello everyone, I am Dr. Ghanee. I am an oral pathologist. Today I'm going to continue talking about oral lichen planus. As you remember, we talked about clinical features of lichen planus, and we said if we see just white lines in the mouth and no ulceration, no redness, no inflammation, that is a mild lichen planus and it does not need treatment. But cases of lichen planus like this, when we see white lines and we see red areas, inflamed areas, and even open sores, these are considered erosive lichen planus and they need treatment. Patients always ask me if their oral lichen planus can change to cancer or not. The answer is yes, but the chance is low. We wrote a paper about this particular case, and if you are interested, you just type oral lichen planus and my name and you can see all the details. I checked this patient since 2012 until 2018, and she developed cancer. She had lichen planus and she developed cancer twice, in 2015 and in 2018. So that's a very interesting case. The chance of malignant transformation is about 0.5 to 3.5%, and I rarely see an oral lichen planus changing to cancer. Actually, I have seen it just twice. This is one of them. So I'm going to explain this case because it's very interesting. Features of lichen planus change in the oral cavity. As you can see, this is upper left gingiva in 2012 and this is 2015. So these red and white lesions, they're not as stable, they always change. Sometimes we have even white keratotic areas. Sometimes, as you can see here, the fiery red inner cheek gradually change to fiery red gingiva. So features constantly change. This is lower right. It doesn't show features of lichen planus. It actually shows thick keratinized gingiva. So look at 2012 upper right gingiva. We don't see prominent features of lichen planus, but this is not normal either. We see a lot of keratinized thick gingiva here. And then I kept checking and rechecking this patient until in September 2015, I see this red growth and white growth on gingiva, and look how this area has changed. This is not red and white lichen planus. We don't see those white lines like lichen or branches of a tree. This is a growth that's white and a red area that is very inflamed. I performed a biopsy and they checked the white area and the red area under the microscope, and both of them were gingival cancer. So in this patient that constantly showed features of lichen planus, eventually this side changed to cancer. She went through a lot of surgeries, and as you can see, they have removed those involved teeth, and even there is opening to maxillary sinus. I kept rechecking her, and as you can see, features of lichen planus are here and there. White lesions, white lines here, some red areas here, some red and white there. And this area gradually became more puffy and more prominent. They gave her an obturator, and she was wearing the obturator, and she thought that was irritating the gum tissue. This is the important part that I talked about it in my previous videos. Sometimes these features are really lichen planus, but sometimes they're lichenoid reaction, which means some exogenous factor is irritating the tissue. In this case, it can be the obturator. Sometimes features are mixture of lichen planus and lichenoid reaction. And I don't want to confuse you, but there is one more thing. This patient had severe psoriasis, so this can be all of it oral manifestation of psoriasis. But biopsy with head and neck surgeon in the past confirmed the diagnosis of lichen planus. Now you can see over 3 years when I checked her, always showed red and white lesions, and I talked about treatment of lichen planus. So we got treatment done for her, but we tried to keep everything under control: white lines, red areas. And her tongue is classic lichen planus. Again, here you see white lines and red areas. So we kept rechecking her. In 2018, she developed another cancer right in the area that she placed the obturator, she placed the partial denture. You can see this is the second cancer that appeared in 2018. So she had to go through another surgery. She got rid of it and she's doing very well. This is an interesting case. If you want, you can find it online as a paper, oral lichen planus, with my name, and you can see all the details. So overall, if patients have erosive lichen planus, they're worried about change and malignant transformation, change to cancer, they should go to their provider periodically so they can check everything. Also, they should get treatment to keep the inflammation and open sores and edema and redness under control, because the more inflamed the area is more prone to change to cancer. But overall, the chance of malignant transformation is low. Thank you so much for listening. Have a good day.